Hey, greetings, everyone. This is your host and Vice President of the American Institute of Stress. It's Will Heckman. Thanks for joining us again. Really appreciate it. I'd like to also ask that all of you who are watching or listening, go to stress.org. Make sure you check out all the resources we have. Subscribe to a magazine. It's free, and you get a lot of great information there. And, while I'm talking about subscribing, I'm going to stop because I got some really good news. We just got voted as in the top 10 out of the top 100 stress podcasts. So I really appreciate all you guys out there to take the time to hit that like button, especially those of you that subscribe. That's what got us in. It's guys and girls like you. Thank you. So make sure you subscribe. And also, don't forget today's podcast is sponsored by AlphaStem. And, if you're struggling with anxiety, insomnia, pain, you need to take a look at AlphaStem. It's an FDA-cleared non-drug medical device trusted by healthcare professionals worldwide. AlphaStem's proven patented technology uses a gentle microcurrent to help you feel better and do it fast. And it's without the lasting side effects of medication. It's easy to use, it's portable, and it's backed by extensive clinical research. AlphaStem fits right into your daily routine. So make sure, go visit alphastem.com to learn more about it. I've used it. I love it. All right, today we're going to be talking about something that really affects most of us. I hate to say that, but it really does. In one way or another, either you're experiencing it or you know somebody who is. And that's work burnout. Work burnout is more than just a feeling of being tired or overwhelmed. It is a state of emotional, mental, and physical exhaustion that develops when chronic stress goes unmanaged for too long. And it often shows up as, just cynicism, a reduced effectiveness, but also as a sense of disconnection from work that you once felt was meaningful. Recovery is not simply about taking some time off either. It requires intentionally addressing the source of stress, restoring healthy boundaries, and reconnecting with the purpose and support. True recovery happens when people like you and I are given the space, the tools, and maybe permission to rest, reflect, and rebuild resilience, allowing energy and clarity and motivation to return and return in a substantial way. So I asked a friend of mine to join us today, Dr. Rozina Lakhani. Dr. Rozina is a board-certified psychiatrist, a best-selling author, transformative mental wellness speaker, and a contributing editor of Contentment, the magazine of the American Institute of Stress, which is going to come out again soon. With over 25 years of experience, she specializes in burnout recovery, anxiety relief, brain-based emotional wellness, and also after experiencing a stress-related burnout herself, which led to a terrible car accident and a broken hand, Dr. Rozina became passionate about sharing the same life-changing tools that helped her and her patients heal. And she currently serves as the medical director of Shifa Health, which leads the Precision Wellness Clinic, which offers advanced diagnostics, including stress hormones and genetic testing. And she also directs a fellowship program for psychiatric nurse practitioners. Dr. Rozina is the author of Stress to Joy, Rewire Your Anxious Brain, 5-Minute Guide Gratitude Journal. She has an upcoming book that we're going to talk about a little bit called Workout Burnout Recovery, 7 science-based strategies to reduce stress, restore energy, reignite passion, and enjoy guilt-free work-life balance. She also is the host of the Happy and Healthy Mind podcast, which is great, and a Vistage speaker delivering talks on emotional resilience, burnout prevention, and brain wellness for high achieving professionals. Her work blends neuroscience, mindfulness, and compassionate storytelling to help people reduce stress, improve focus, and reclaim joy, no matter what they're facing. So please join me in welcoming our friend, Rozina Lakhani. Dr. Rozina, thanks so much for being with us. I know you are so super busy and taking the time out to talk to us today. I really appreciate it.
Well, it's a blessing for me too, and it's an opportunity to get the message out to your audience. And if one person can feel better, then my purpose also gets fulfilled. So I'm grateful.
That's awesome. Thank you for saying that. I know you've been in this business for a long time, but what initially led you to shift your focus in writing, you know, to work burnout, which is such a common problem?
Yeah. Instead of shift, I would call it progression.
Hmm.
So, you mentioned in your introduction how increased stress led to my own burnout and led to a car accident when actually I broke my right hand. And that was like really a shift from just being a provider, a doctor in the clinic, to getting those techniques and tools from inside the clinic to outside the clinic for people who are not sick yet, to prevent them from reaching that point and prevent the unnecessary suffering. And so that's where the calling to write and doing the podcast and speaking came up. And so I've been doing that for last 8 years now. My first book, Stress to Joy, came out in 2018 when it became a bestseller. But it was kind of this shift. And then I wrote the guided gratitude journal because that was the most important technique that helped me through my phase of recovery.
Let's talk. You talk about recovery. We're talking about burnout, but how do you define burnout? I mean, what do you think the most often thing that's misunderstood about it is? You hear the word burnout. It has levels, doesn't it? There's different forms of burnout.
Well, you are right on the point. And so I was giving a talk on at an international conference last weekend, and I met somebody, and I was asking. We were talking about the topic, and she said, I don't like to use the word burnout because it's negative. Um, I'm able to function, but I'm really getting overwhelmed and I'm not performing the way I used to because there's so much demand and from the work and trying to create balance with my family life and personal life, I am finding it very overwhelming. So she wanted to use the word overwhelming, but she did not want to use the word burnout. And she was at this cusp of burnout. And then again, it's like it's the progression, it's the signs, early signs that come up that people don't realize that she was kind of becoming a little snappy with her kids. Her sleep was a little disturbed. She was like not getting that enthusiastic or that energetic with the same projects that she used to. She's passionate about her work. She's a lawyer, and she really likes to help people. That is her calling. But yet her passion was kind of reducing. And those were the early signs of burnout that many times people miss out because they think, okay, a total burnout is when, which actually happens when you're not able to get out of bed, when you're not able to function at all. So that's kind of the extreme form of burnout. But it starts with kind of gradually showing its sign here and there. And I had one friend who said, I reach to the level of burnout like 3 times a year, and then I take a vacation, and then I get better. But so that was his coping mechanism, and so people think that just taking the vacation is going to change take them out of the burnout. it helps partially, but you can't take vacation all the time, right?
No.
As soon as you come back in the same situation, and if you have not changed the way you think, you approach, you reflect, you kind of create those boundaries, then you're right at the point zero. So that is
That's
kind of the misunderstanding. I see people that sometimes they don't recognize early signs and then they take the major break, but then they get back into the same pattern. So if they develop these systems, that they can make it harder for burnout to happen.
you're exactly right. I've heard this story so many times from different people in different professions. They said take a vacation, I feel better. Well, Dr. Kirsch is president of the American Institute of Stress, always says that, to charge your phone, you have to plug it in. To charge your brain, you have to unplug it. So you may take a break and unplug your brain for a little while, but you're still going back to the same problem that drained it in the first place. And I know it happens at burnout and progression. I've seen it. As an educator for many years, I've seen teachers year after year come back after summer break, enthusiastic, but slowly, year 3, year 5, develop into that person that's a little crispy around the edges. So, how does that develop over time? If you're doing the same profession, but yet and I hear it amongst young doctors too,
Yeah,
that they're getting burnt out.
yeah, yeah.
How does that progress? How does that happen? Does it just build up?
I think it's I like to say is like, as the level of stress keeps on going, and actually there's a difference between stress and burnout. Let me just clarify that. So
Please.
stress um, is kind of used for both stressors, which are coming from outside, and the stress reaction or response that you're giving, okay? Or how you're responding to that stress. If it is just knee-jerk type of reaction, we call it stress reaction. And if it is thought out, intentional, then we call it stress response. So stressors are coming from outside. Sometimes they're not in your control. What you do, how you respond to those stressor can be a stress reaction that is harmful for your body, or it could be stress response that kind of helps you adapt to this demand. So the longer this goes, like, if the stressors are more than the your ability to cope with it, then you start going into negative.
Right.
Okay. And the longer it goes, where you are in negative, you're using your reserve, your inner reserves, you're using it, using it, using it. And you reach to a point where the reserves are not enough to meet the extra demand, then you start getting into the burnout. So
Mm.
that's kind of the difference between the stress and burnout. I like to use an analogy. I call it emotional coping account. So everybody has a bank account, right? So you have a bank account, right? There are deposits and then there are withdrawals, right? What would happen to your bank account if the withdrawals were more than the deposits?
You'd be in trouble.
Yes. Your checks would start getting bounced, right?
You'd be in trouble on many levels.
Yes, yes. And so similarly, we have our emotional coping account or resilience account, okay? All the things that you do to take care of yourself that builds your resilience are deposits. All the things that you do that drains you, that stresses you are your withdrawals, okay? And stress is inevitable, it's going to be there. Any demand, and actually if there is not enough stress, that is also negative. So
Right.
right amount of stress is appropriate for your body. So what happens is, if your stress is coming, you need to keep pace with your deposits so you can stay in positive. And then when you are in the positive state, you want to keep doing like no small deposits, so you have enough cushion, balance, resilience. So then if there is an unexpected stressor that comes, you are able to handle it without going into negative.
Makes
So
sense.
yeah. So keeping the balance in emotional coping account is a way to prevent stress reaction to going into burnout.
You mentioned something that really caught my attention because I've seen it, and that was the control, how much control you have in your profession, and how much workload you have. And those two things, do you think those are the two major uh, um, suspects in the what's driving that person to burnout or be
I think,
overwhelmed, either way?
yeah, I think there are two major forces. One is, as I said, external stressors, organizational culture that you are describing. Dr. Maslow calls it like, systemic burnout factors. Two major ones are workload imbalance and sense of control on what you can do. Some of the other ones are like lack of enough feedback, support, uh, encouragement, feeling of fairness or unfairness,
Mm,
um, and so loss of community if the community starts breaking down. So creating those environmental or cultural changes helps decrease the risk of burnout. So that is definitely. The other major force is personal. So like you used to say, okay, is the burnout the whose responsibility is it? Is it the personal responsibility or it's the employer responsibility? I think it is the balance.
right.
I was doing this as I was talking, but like, I had this talk this weekend, and I was helping one of the volunteers through his fear. And so we talked about um, what what is in his control. Now, he's an IT professional. And so there's so much deadlines, tight deadlines, and they have to meet all these demands that he really was feeling at risk of burnout. And I said, okay, so what is in your control? You see, I always use this concept of circle of influence versus circle of concern from Stephen Covey's book, Seven Habits of Highly Effective People. He talks about that there are lots of things in the world that are in your circle of concern. You're concerned about it, it affects you, it affects the things that you care about. But a lot of those things are not in your control. There's a smaller circle inside that is called circle of influence. Those are the things that you can do something about. And the more we focus on outside our circle of influence shrinks.
Mm,
And the more we focus inside our circle of influence, our influence increases.
mm,
So as I was working with this IT professional, and he's saying like there's so much demand and so much deadlines that sometimes he's not able to take care of himself and create those work-life balance boundaries. And so we talked about, can you talk to your supervisor and say, out of these six things, which is the biggest priority you want me to focus on? And second and third. And he said, yes, I can. So, like, you're not saying no, you're just saying how to prioritize. And
right.
so the way you approach it. And then I said, can he stop you from taking 1 minute break between the meetings to do your breathing exercises? And he said, no, I can do that. That is in your control. Said like, is it in your control to kind of do a morning exercise or eat a really healthy breakfast? And he said, yeah, I can do that. So a lot of these things are in our control, but many times when our brain is overwhelmed and it's just so much demand that we are not even able to think about what is in our control and what is not in our control. And our mind keeps on going to things outside our circle of influence, things that are not in our control, and then it makes us more overwhelmed, and you kind of get stuck in this cycle, like, you feel stress and then you feel overwhelmed and then you feel more stress and more overwhelmed, and it keeps on going on and on until you burn out. And so therefore I always say, okay, as your stress is going up, if you take these little breaks, these reflective type times to kind of think through, then your stress level would go down. And then it would go again up because you're doing the things. But then if you take the break again, it would come down. So if you keep on taking these little micro breaks, then your stress level doesn't keep on going up, 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 up to the point of crash.
That's why it's called stress management, not stressoration.
That's right.
You can't arrest your stress. You mentioned a couple of things that that I wanted to talk to you about being a doctor is, and I know that it can build up, and I know that, but burnout has some real physiological health, effects on us,
Correct. Correct.
and I've seen the really bad negative effects of people who were burnt out and ignored it, didn't take a moment to do breathing exercises or reflection or just take time, just take a moment. And they didn't. They went. There's a saying for teachers, teach like your hair is on fire. Well, I thought that was crazy, but but because you need to stop you for a moment. Tell us, everybody who's listening, because they may not recognize it's going on in themselves. What are some of the physical health and overall signs that a burnout might have on you?
Yeah. Let me answer this question in two different steps. Number one, when you were saying that, like, some serious problems could have physiologically. And so one of the big, like, I was talking to another audience member in this workshop, and so I said, like, we want to prevent the burnout from becoming irreversible, causing irreversible damage. And she said, I didn't think that burnout can cause irreversible damage. And I said, yes, it can. Because maybe the phrase burnout, like, what you see, okay, you're feeling tired or exhausted, and that should not have, like, permanent damage. But what is happening in your body actually can increase to the point where people are dying, like they're
Yes.
dropping dead because of a sudden heart attack, because the stress level has built so much um, that the stress hormones is affecting their heart health or
Mm-hmm.
their breathing health or their gut health. And so let me kind of go a little bit scientific. Sometimes people get turned off when I talk too much science. On the other hand, some people really want to understand what is the biology
Right.
of burnout.
Well, we need to understand.
Right. So what happens is, and people may have heard about cortisol being a stress hormone. And so sometimes people think cortisol is a bad hormone. Actually, cortisol is a survival hormone. It is necessary and needed for the body to respond to demands of the day. And so when in the morning you get up, your cortisol level needs to be high so that you have enough energy to face the stressors of the day or demands of the day. And then as the day goes long, the cortisol level keeps on going down and down and down. And at night, it is like really low so that your mind can calm down and you can fall asleep. And as it is low at night, it gives the message to your brain, HPA axis, that we would need more cortisol in the morning. So then the brain sends a message to your adrenal glands. The adrenal glands produce more cortisol, and you are refreshed and ready to face the day in the morning. But what happens is, and so this is kind of survival hormone. It affects a lot of body systems, including your insulin levels. It interacts with your insulin level. It affects your ability to protect yourself from infection. So
Mhm.
your antibodies level and a lot of hormones are kind of interconnected. But like to simplify, the cortisol, the normal functioning is like this, and we call it diurnal cortisol pattern.
Okay.
Whenever then there is additional stress, then there is a spike in cortisol. So adrenal gland produce extra cortisol. So the normal diurnal cycle is going like this, and then there is, you are running late for an appointment, and you're driving fast, and then suddenly there's an accident or something, and then you have to put the brake, and your heart is beating fast, and you're kind of really tense. So that happens because there was a stressor, and then the body produces extra cortisol to help you cope with that stressor. And when the stressor goes away, then the cortisol comes down. So there's a diurnal pattern, and then there's these peaks that come with the stress. What happens if you're constantly in that stress reaction? The spike doesn't get the chance to come down because it's constantly high, high, high. And if it is that high, by the time you reach home and you're trying to go to sleep, now the cortisol level is too high, your brain is too active, and you're not able to sleep. And when you're not able to sleep well and your cortisol level has not gone down enough, then the brain doesn't get the message to produce more cortisol in the morning. So now you have low cortisol in the morning. So, like, this whole cycle is disturbed. Now you feel tired in the morning because you don't have enough cortisol, and you're not able to sleep at night because you have too much cortisol. So it's not just the level of cortisol which is a problem, it is how it is maintained in the body.
Mm.
And so when you have constant stressor and the cortisol is high, what is your stress reaction? How your body is reacting. So if there's a stressor, cortisol goes up, it helps you prepare for fight and flight, right? So it gives the message to your heart to beat faster, send more blood to the muscles. Blood vessels tighten to get more for the more pressure to send the blood to the muscle, so it is ready to fight if there's a predator. Your body is like ready to fight or flight, run away to protect yourself. So it's a protective mechanism. Stress reaction is a protective mechanism of the body. It is supposed to help you get all the blood or all these supplies of blood and oxygen to your muscles so you are able to save yourself. And so in that process, the blood is taken away or it's not going really well to your GI system, stomach, right? And so then if the blood doesn't go, that supply doesn't get reestablished after the stress goes away, then your stomach is not able to perform well. It's not able to digest well. And so you can have stomach problems, digestive problems. What happens if the heart has to keep on beating too fast, too long, and the blood vessels have to just stay really tight? Blood pressure goes up. Your heart problems can happen. You can have stroke. So there are lots of physiological problems that are happening because the system did not get the chance to reset. That phone did not get did not get charged, or your brain did not get time to uncharge or
Right.
de-stress. And so if you have this rhythm of dealing with a stressful situation but then de-stressing, then your body and brain can come back to its baseline, then it's ready for facing more stressors of next day, next project, next quarter, whatever you want to address.
And this doesn't just happen by itself. If you're listening to this, what, what Dr. Rozina is telling you doesn't just happen. You need to do it. You need to do something, but you need to manage your stress. Because if you don't take, and it's not hard. It was funny, you were talking about how stress affects our gut. I was talking to a nurse the other day. Um, I've had gastro problems in the past, and she said that 85% of visits to the ER room are gastro related, mostly due to stress. And it's like I said, I couldn't believe that. So you have to actually do something about that. You can't just let it happen. Some I know in your book you have some practical steps and advice on what to do on the new book. Tell us some things that we can do to build that resilience. We talked a little bit about breath work. I'm a big believer in breath work. first of all, it's free, and you don't need any special equipment. And that's a great thing to do. But there are other things too.
Right. There are lots of things, and I won't be able to cover all the techniques in the book, but let me just give you the 30-foot
Right.
understanding of what I've been trying to do in the book. So the book cover has an image of a candle. Okay? And the reason behind it is that light of the candle is soothing. It gives light, right? When it is contained in the candle. But if that fire gets out of control, it can also burn the house. Right? Similarly, the fire of passion, the inner fire that gives you this desire to do things, to make a difference, when it is contained, it can help you perform at your best. But if it gets out of control, then it can burn and cause burnout and can rob you of your ability to continue to make the impact in the world that you're meant to make. Because many times when people get overwhelmed, what do? They quit their jobs.
Yeah.
Okay? When they're let go because they're not performing well.
Right.
But so what happens is it is the opportunity cost not just to you, not just that you have lost your ability to function and earn the money and live your best life and make a difference on other people's life, but all the other people who could have benefited from your work also are at loss. So when a doctor who's supposed to work for 10 more years, but they retire or quit 10 years earlier because they got burnout, all those people who could have benefited from them over next 10 years have lost that opportunity. So
True.
it's huge that it is your responsibility to take care of yourself, not just for yourself, but for all those people in the world that you would have been able to benefit if you are able to manage your stress and prevent this burnout from happening. Okay.
That's so true.
So, yeah. So in the book, I have used this a framework of water. So like when there's too much fire, then you use water to reduce the control the fire. So what does water stand for? It's W is asking why. Why are you doing what you're doing? And why are you continuing to do the things that are causing problem? And so understanding your why may help you modify things so that you can continue to keep this fire of passion going without burning out. And the second is acknowledging and assessing where you are on the what I call it um, continuing of journey of life. And I use this analogy of traffic lights on road of life. And so on the road of life, road is kind of curvy and there are many traffic lights. Sometimes they're green and life is flowing smoothly. Okay? Sometimes they're yellow. Either you need to collect all your energy and push that brake and get through it, or slow down and take a breather. And sometimes it is red and you're forced to stop. And so you need to kind of take that break and get your energies back. And sometimes it's black when the traffic lights are, malfunctioning and the whole traffic is jammed. And you need external help to kind of guide the traffic. Um, but no matter how bad the traffic lights are and how bad the traffic jam gets, it always starts flowing again. So having this hope that no matter how bad your situation is, there are steps that you can take to get through these life stressors. But assessing and keeping and you go through different phases. It's not like, light switch, one or the other. You kind of go through these stages when sometimes you're burning out, sometimes you're better, and sometimes you're in green zone, and sometimes you're yellow zone, sometimes you're red zone. So you need to adapt to whatever is the need at that point in time.
That's
And
life.
then say it again.
I said that's life.
Yeah,
Sometimes they're like you said, they're green, and sometimes they're yellow.
yeah, yeah. And so when people come to us for I have a burnout recovery program, and actually I call it reverse burnout coaching, because basically you want to reverse this process. So we kind of check these cortisol levels, and we assess where the person is in terms of the severity of impact it has already had on the mind and body, and then work through building those resources again. So the third step is to train or treat. And so we train the mind, we train the body, we train the soul to kind of get back to the the approaches, the lifestyle, the value system, adaptation or harmony that can allow you to function at your best. And if you are in red, go to yellow, and from yellow to go to green, and stay in green and not go slip back into yellow or red. And so the training and treatment comes. So that's T of water. And then E is the environment. And so you want to modify environment. And environment is not just physical environment, but also culture environment, the time boundaries that are important to kind of keep it at the optimum so that you can continue to function well. And then R is for relationships. And relationships are, it's so important that sometimes in the work demands, um, we tend to kind of keep the relationship as a secondary level. And then, if you get burnout or you get sick, you would your organization or your employer is going to replace you.
Oh yeah.
What is going to help you recover is your own resilience and your relationships. And so giving importance and building those relationships helps you become more resilient. So that's the framework. And so I go into the tools for each of those steps involved, with the asking why, assessment, training mind, body, soul, environmental harmonizing, and then relationship building. And maybe I can share one of the technique from relationship building that that is kind of started with my own life, and I learned a little bit from other places, but I had to really apply in my life, and that a lot of people felt was very beneficial. So I would like to share that with our audience today.
Please.
So I call it 10-1-3 rule. Okay. And that is the rule about creating this boundary between work and home. And I know some of you guys may be working from home, and so it may be harder, but you can apply it in a different way. So I started using it when I used to work in Mount Vernon, and I used to have 30 minutes drive to go pick my child. And I started realizing that if I'm thinking about work, a patient or whatever happened at clinic, if I'm still thinking 10 minutes after leaving the clinic, then I'm putting myself at the burnout risk. And so I made an intention of this 10-minute check mark. If I'm still thinking about work, I would intentionally let go. I'm out of work, whatever is at work would remain, and I will handle it tomorrow. So I intentionally developed this way of, okay, letting go. So 10 comes from that. Then you reach home and you take 1 minute to wrap up whatever was, if there is a text message you need to do that, you can finish it. There's an email, you want to finish it, and you want to close your phone and put it in the pocket. So you're not walking in the home with the work with you. Okay. So that's 1 minute to wrap up. And then comes the 3 minute rule. And so, if you go out on vacation or something for a month or so, and then you come back home, how do you greet your family? Hey, how are you? How did it go? Like, you're kind of excited, you're happy to see these most important people in your life, right? And you want to kind of connect at that point. But what happens when you're coming back at home after the whole day?
Mm.
Like, especially if you're carrying the frustration of work and like, whatever is on your mind, and you go in and you see, well, I'm sorry to accept, but I was like that too. I would open the door and I would see, the bag on the floor, and the kids have not taken care of things. And I'm like, why I asked you to do this? Why didn't you do your homework? Why is the things on the floor? And I would, like, as soon as I would enter, I would get, like, this irritated with, because I'm carrying the irritation from work. So I learned this 3 minute rule. When at the door you say, I'm going to meet the most important people in my life after a whole day. And so you reset your mind, you open the door, and then you follow 3 minutes of no complaints. And so you'll see, do you see how that could change your
I love
relationship?
that. I think that's a great rule to have, and it's a great tool. And it's exactly what I mean when I say that you need to do something. You need to be consciously doing something to fight off all the stress and burnout that happens to us. And this is exactly what I meant. And it's a great time for us to pause, because that was something everyone should take back with them. And in fact, what I want you all to do is explore more about Dr. Rozina. Um, if you want to, all you have to do is visit her website is drrosina.com. I'll put it up that people can, or you can follow her at the Happy and Healthy Mind podcast, which is weekly. Tools for reduces stress, builds resilience, just by the way she spoke of today. And don't forget her upcoming book. When is it coming out, or has it already?
No, right now I'm accepting like early readers so people can
Okay.
sign up to be the early readers. And as I said, like, I keep on incorporating these feedbacks in the books. So the framework is ready. I'm accepting kind of feedback at this point in time. And as soon as that phase is over, it should be coming out pretty
Well,
soon.
well, might be on the lookout for it because it's coming out soon. It's called
Yeah.
Work Burnout Recovery: 7 Science-Backed Strategies to Reduce Stress, Restore Energy, Reignite Passion, and Enjoy Guilt-Free Work-Life Balance. That's so important. Um, it's available, like Dr. Rosina said, at happyandhealthymind.com. I'll put the whole uh, address where you can find it and sign up to get it. Sooner or later, like everything else on the planet, it'll be on Amazon. But in the meantime, go to this uh, URL and sign up for it. And you can also get free tools and stress trackers and burnout guide. Just join her newsletter. That's my advice. It's called reverseburnoucoaching.com / burnout guide. Again, I'll put that up in the tools. Rosina, I have to thank you. You not only taught us, but you gave us some really usable tools to help us fight out off the burnout and going in the wrong direction. Because if you don't do something, to be honest with you, there's many things you can do to help with your stress, to help reverse burnout. The one thing you should never do is nothing, because then it turns into a diagnosable problem. And we don't want to have that. Rosina, thank you so much for being here. I appreciate you taking the time to teach us a little bit about stress. I'm so looking forward to seeing your book. And I want to thank you for bringing awareness, as you always have, to the issues we talked about today. So that's going to do it for today. This has been your host, Will Heckman. Thank you all for joining Finding Contentment again. Don't forget, subscribe, make us number 1 instead of number 8 on that. And then, like I said, I want to remind everyone, just as stress is different for all of us, there is no one stress reduction management strategy that's right for everyone. That means you need to join us next time, because we're going to explore more stress management strategies and insights. So take care, everyone.